Safety Data Exchange Agreement. Welcome to this presentation on Safety Data Exchange Agreements, SDEAs. SDEAs are critical documents in pharmacovigilance, ensuring that all safety data related to a licensed product are efficiently communicated between contractual partners. This helps the marketing authorization holder, MAH, fulfill their legal obligations to aggregate and report safety data in a timely manner. Today, we will discuss the importance, definition, key components, and practical examples of SDEAs. Disclaimer. Before we proceed, please note the disclaimer. The content presented here is copyrighted by NextPV Services SRO and reflects the views of the creator. While our team leverages AI to enhance our operations, the responsibility for accuracy, relevancy, and integrity remains with our human experts. This ensures that we provide high-quality, timely, and informative content. Please keep this in mind as we move through the presentation. Today's presentation will cover the background and definition of SDEAs, the responsibilities involved, and examples of contractual relationships. We will also discuss the structure and key items of a detailed SDEA. Compare SDEAs with the Pharmacovigilance System Master File, PSMF, and provide practical examples of how SDEAs are implemented in various scenarios. This comprehensive overview will help you understand the critical role SDEAs play in pharmacovigilance. Background outsourcing. Pharmacovigilance activities can save pharmaceutical companies significant time and money. However, the MAH and the EU qualified person responsible for pharmacovigilance, QPPV, must always oversee and manage the pharmacovigilance system. The MAH remains legally and regulatorily accountable for all pharmacovigilance activities, even when outsourced. This includes properly receiving, handling, and reporting adverse events and other safety data. SDEAs regulate the receipt and handling of safety information, ensuring that it is properly managed and communicated back to the MAH. Background SDEAs are legally mandatory in all situations where any third party might receive safety data. This includes individual case safety reports, ICSRs, periodic safety update reports, PSURs, risk management plans, RMPs, and responses to regulatory authority queries. These agreements ensure that all safety data related to a licensed product are promptly and reliably communicated to the MAH. By doing so, they help maintain the integrity and compliance of the pharmacovigilance system. Definition Safety Data Exchange Agreements, SDEAs, are legal written contracts that ensure all safety data regarding a licensed product are quickly and reliably communicated back to the MAH. This allows the MAH to fulfill their legal obligations to aggregate safety data and submit safety reports in a timely manner. SDEAs are essential for maintaining regulatory compliance. The MAH is primarily responsible for having an SDEA in place to ensure no safety data falls through any gaps. This applies to both clinical, trial, and post-marketing situations. Responsibility. The responsibility for pharmacovigilance ultimately lies with the MAH in the post-marketing phase and with the study sponsor during clinical trials. While tasks can be outsourced or transferred, the ultimate responsibility for pharmacovigilance cannot be transferred. This means the MAH must ensure that all safety data are properly managed and reported, regardless of who performs the pharmacovigilance activities. Contractual relationship. Examples. There are various types of contractual relationships where SDEAs are necessary. For example, when two MAHs are involved in a license agreement, they share registration procedures and pharmacovigilance obligations. In distribution agreements, the MAH uses a distributor who might receive safety information, requiring a limited SDEA. In co-marketing agreements, each partner sells the same product under different brand names, necessitating detailed SDEAs. Co-promotion agreements involve using a sales network partner to promote the product, also requiring SDEAs. These examples highlight the need for clear and detailed SDEAs to ensure compliance. How it looks like. An SDEA can be a standalone document or part of the main contract, such as a license or distribution agreement. A detailed SDEA covers all pharmacovigilance responsibilities, including ICSR collection, signal management, RMP, PSUR, literature monitoring, and more. It must include a link to the main contract and cover all necessary pharmacovigilance activities. In contrast, a limited SDEA may focus on specific aspects of safety data exchange without routine data exchange. What should detailed SDEA contain? A detailed SDEA should include several key elements. These include the contractual parties and their roles, reference to the master agreement, product and territory details, contacts, and delegated pharmacovigilance activities. It should cover compliance verification, global database responsibilities, pharmacovigilance system, details, signal detection, safety queries from competent authorities, literature and internet monitoring, and ICSR collection and reporting. The agreement should also address the reconciliation of safety data, acknowledgements, and the reconciliation process. What should detailed SDEA contain? Additionally, a detailed SDEA should cover miscellaneous aspects, such as the duration and term of the agreement, contact details for both parties, monitoring of compliance, management of deviations, effective date, and signatures of authorized persons. It should include definitions, abbreviations, and annexes, addressing anti-bribery provisions, resource management and training, confidentiality, subcontracting, data privacy, applicable law, communication language, and archiving. What should limited SDEA contain? A limited SDEA should cover safety-relevant information, including adverse reactions from any source, product quality complaints, and medical inquiries. It should address the use of the medicinal product within and outside the terms of the marketing authorization, such as overdose, off-label use, misuse, abuse, medication errors, and occupational exposure. The agreement should also cover suspected transmission of infectious agents, drug exposure via pregnancy or lactation, lack of efficacy, interactions, unintended beneficial effects, and any safety-related distribution restrictions or counterfeit cases. Examples. In a license agreement, a harmonized procedure such as MRP, DCP, or CP may involve multiple MAHs. This situation requires a detailed SDEA to ensure all safety data are managed and communicated properly. In a distribution agreement, the MAH handles the registration procedure, and the distributor may receive safety information. This scenario typically requires a limited SDEA, focusing on ad hoc transmission of safety-relevant information from the distributor to the MAH. These examples illustrate the different types of SDEAs needed to ensure regulatory compliance and effective pharmacovigilance. SDEA versus PSMF. The Pharmacovigilance System Master File, PSMF, includes a section on the organizational structure of the MAH, detailing links with other organizations such as co-marketing agreements and contracted pharmacovigilance activities. It provides a description of contracts and agreements related to pharmacovigilance obligations, organized by service providers, commercial arrangements, and technical providers. Individual contractual agreements, including SDEAs, must be available upon request by national competent authorities or during inspections. This ensures that all pharmacovigilance activities are documented and managed effectively. Thank you for your attention. As we conclude this presentation, I want to thank you for your attention and participation. SDEAs are essential for ensuring the safe and effective management of safety data in pharmacovigilance. Should you have any further questions or require additional information, please do not hesitate to contact Next PV. We are committed to not just fulfilling tasks, but to supporting and taking care of our clients with the highest standards of professionalism and expertise.